Welcome to Inside Out Mental Health at Work and in Life, the podcast where we explore new approaches to supporting mental health, creating inclusive environments, and driving positive change. Today, we're shining a spotlight on ourselves and how we're transforming the way mental health first aid is delivered. Traditional mental health first aid often takes a medical approach. It focuses on identifying symptoms of mental health challenges and responding to a crisis, much like physical first aid. While effective in emergencies, this approach can overlook the broader social and systemic factors that contribute to mental health challenges. This is where we stand out. We've embraced focusing more on prevention and early intervention using the social model of mental health, which shifts the focus away from medicalized discussions around diagnosis and instead examines the external pressures and societal structures that impact well-being. So what does this look like in practice? Our training encourages participants to think critically about how their environments influence mental health. How does workplace culture affect people's ability to thrive? What role does stigma play in whether someone seeks help? How can organizations create inclusive spaces where everyone feels valued? These are the kinds of questions we tackle in our sessions, helping participants move beyond crisis management to discussions about the root causes of emotional distress and appreciate the non-medical role that they can play in supporting those around them. The social model of mental health emphasizes that challenges often stem from external pressures rather than internal flaws. Factors such as financial struggles, discrimination, or unhealthy organizational practices can create environments that harm mental well-being. By exploring these influences, our approach empowers people to build connections with each other and create more inclusive workplaces and communities. Our training equips participants not only with the tools to assist someone in distress, but more importantly, the skills to identify and challenge the systemic issues contributing to these in the first place. Unlike the traditional approach, which is often focused on reactive interventions during crises, our training places more importance on prevention and early intervention. Imagine a river where people keep falling in. A medical model focuses on rescuing them from the water, which is undeniably important. But the social model goes upstream to find out why people are falling in and what can be done to reduce it. We incorporate Maslow's hierarchy of needs to explore the layers of human motivation, from essential physiological survival to the pursuit of self-actualization. We also use its workplace-specific adaptation to help organizations understand how their employees' needs, such as security, belonging, and purpose, impact engagement and fulfillment. This insight is complemented by the concept of emotional agility, which empowers individuals to shift from rigid, reactive thinking to flexible, adaptive approaches when navigating challenges. By combining these frameworks, we provide a holistic perspective on exploring well-being and unlocking potential in both personal and professional settings. Our proactive focus makes our training particularly impactful for organizations looking to create sustainable change. So, how can you apply the social model of mental health to your own life or workplace? First, work to create safe spaces where conversations about mental health are normalized. After all, we all have mental health. This could be as simple as arranging regular one-to-one check-ins or providing anonymous ways for people to share feedback. Second, consider the bigger picture when talking with someone who is experiencing poor mental health. External pressures like workload, team dynamics, or personal stressors often play a significant role. Finally, invest in preventative measures. Even small initiatives like promoting flexible working or organizing regular workshops can have a big impact over time. But they need to be consistent and involve everyone. Our approach to mental health first aid stands out because it combines practical skills with a deep understanding of the social and systemic factors affecting mental health. By doing so, we empower participants to support individuals while also creating long-term cultural shifts in organizations and communities. If you're interested in learning more about us and our transformative approach, visit our website or connect with us on social media. Thank you for joining us today on Inside Mental Health at Work and in Life. Don't forget to subscribe, leave a review, and share this episode with anyone looking to make a meaningful difference in mental health. Take care and remember, changing the conversation is the first step to changing the world.